everyone, and welcome to the Code Clarity Podcast. I'm Rena.
And I'm Jean. So today, Rena, I would love us to talk about when the UK code applies to global pharmaceutical companies.
I'm going to assume you mean global as in they're not based in the UK.
Yes, although some global companies are based in the UK, so it's probably worthwhile saying that if you are a global company based in the UK, then the UK code basically applies to almost everything you do. There's a couple of exceptions.
Like an affiliate. Okay, all right. So with that premise in mind, why are we talking about these non-UK global companies if we're based in the UK? What's important about that and the code?
So for the UK companies, what's important is that they will be found responsible if their global colleagues do an activity or produce material, whatever, that does come under the UK code. So if the global colleagues do it and it comes under the UK code, UK companies will be responsible for it. And that's the key. Yeah. When does it come under the UK code?
Yeah, okay. And I know from case rulings, the PMCPA standard line is that we're responsible for the acts and omissions of our global colleagues, even if we didn't know about them. So why don't we run through when does the UK code apply?
Okay, yeah. So the classic line is the UK code would apply if a UK Nexus is involved.
Okay.
What is a UK Nexus?
Explain that. Yeah, what's a UK Nexus? Yeah, what does that mean then?
Okay, so I can think of probably 5 different top areas of what would be a UK Nexus. So why don't we kind of run through them and think about what that would mean? So the most obvious one for me is that the activity is taking place in the UK. So it's an international symposia that's being held in Glasgow or Cardiff or London or something like that. Or it's a UK website. So it's a .co.uk website address, something like that it's being placed on the UK website. It's a UK website address where it's actually on UK soil.
Okay, I agree with that. And so I think that's a good example of a symposium happening at a conference. The second one I might add to that is to say if the materials or the activities actually initiated by a UK-based company. So, for example, there was a case for AstraZeneca where the complaint was about tweets that were sent from America about an American conference. But because the activity had been initiated by AstraZeneca Global, and as you said earlier, that global company is based in the UK, the code does still apply.
Okay, yeah. And then the next one for me, again, I'm going to keep on the conference theme, would be if it was targeted to a UK organisation, outlet or individual. And so what I'm thinking of is if there was, again, maybe an international conference that wasn't in the UK, could be in Europe somewhere or America, might have no UK involvement. But if you then target UK HCPs to go and attend that stand or attend that symposia, then the UK code does apply. This case precedent on that. If it was an international symposia with no UK involvement and there happened to be UK HCPs at that conference and they chose themselves to go to the stand of the symposium, then it would be unlikely that the UK code would apply. But it's if you target those people, and again, if you're putting up social media posts talking about NICE or I don't know, MHRA approval, things like that, then that is looked at as targeting UK.
Well, that's the fourth. I think that's the fourth one, isn't it? If you're referring to a medicine's availability by talking about MHRA, and it doesn't matter if it's on your website or a stand or on social media, etc., then the code would apply. But just based on that example that you were giving there about targeting, I think that's a really important word because sometimes people say, but an HCP might visit our stand. So if your stand is international, you're global, you're in a different country, targeting is the difference between, specifically inviting and pulling people in versus it's an international meeting. You could have every country under the sun there. It doesn't mean you have to look at everyone's codes. So I think that word is important, right? And there was a case, so Daiichi had an international stand, didn't target, code didn't apply. And there was a case ruling for Chiesi where they had a flyer in delegate bags.
Yes, that's the one I was thinking of.
Yeah. Okay, excellent. What about the last criteria for UK Nexus?
So the last one I can think of is that if this is a classic, and we've seen this a lot of times, is those social media posts, usually on LinkedIn, and it's
don't even get me started. Yeah,
put there by the global company, or even a global, like there was one recently where it was an American patient, and a UK pharma employee shares it, likes it, comments on it, and all of a sudden that is brought under the UK code.
And there's this kind of element, isn't there, with social media? I don't know. You see a lot of senior leaders doing a lot on LinkedIn, right? So the CEO of Sanofi, who's officially, I guess, based in France, and the CEO of Pfizer, etc. So I think there's this whole human nature element of wanting to like the CEO's posts.
Yeah.
Versus the kind of stuff that pulls you back, which is, hang on a minute, would it comply if I liked? Would the code even apply? And the answer is, of course, yes. Yeah. Okay, so we know why we're doing this. Oh, sorry.
No, I think I'm beating you to it and saying, what's the top tips?
Yeah, probably. I was going to say, so we've covered off the why and the whens. You give us the top tips then, Jane.
So I say, well, let's look at it from two different viewpoints. So if you are in the UK company, my top tip would probably be proactive. Reach out to your global colleagues. Make sure, because as you said right at the start, you're responsible for the emissions as well. So reach out to them, educate them on when that UK Nexus is, make it simple, make it easy for them to understand, make yourself approachable so that they can come and check with you when they do need it. And
that's easier said than done, be nice to people, but it's so important, isn't it? And I think there are case rulings where the PMCPA almost say that they were shocked to find out that the UK company had no knowledge of this activity beforehand, and they only found out about it when the complaint came in.
Yeah, and I mean, so as communication with everything, communication is so important. So communicate with your global colleagues, and we do love a checklist. That a little checklist to say, actually, this is just have a quick look at this. If you're doing any of this, then come and speak to us, or make sure you know that the UK now applies to this. And I guess similar the other way around, if you're based in global and you might be doing some of these activities, which could be, we've talked about conferences and social media. It could also be advisory boards, inviting UK HCPs. It could be doing market research with UK HCPs. Again, just know when the UK code applies. Get yourself a lovely checklist to make sure you know it. And if you're not sure, ask your UK colleagues.
Yeah, great advice. Thank you so much, Jean.
All right, thanks a lot. Bye.
Bye.